Welcome to my YouTube channel. My name is Hannah, and today I'll be going over chapter 1 of our nursing anatomy series, and I'm going to give you guys little tips and tricks to make your nursing school journey a bit easier. So, what is anatomy and what's physiology? Anatomy is the study of body structure, and physiology is how this structure works. We have types of anatomy. First is gross anatomy. It's the study of body structures that are visible to us through naked eye. For example, your organs, your muscles, your bones, and your blood vessels. Next is microscopic anatomy. It's the study of structures at the cellular and tissue level using a microscope. On a side note, study of tissue is called histology and study of cells is called cytology. From Biology 120, we all remember the 7 characteristics of life, that all living organisms are composed of cells. Second is that all living organisms metabolize. It's a chemical process to obtain and use energy. We have 2 processes, catabolism and anabolism. Cats break things down. This is a cool trick to remember it. Catabolism, we're going to have a bigger molecule broken down into simpler units, and energy is going to be released in form of ATP. However, in anabolism, we're going to have simpler units coming together to make a bigger molecule, for example, synthesis of proteins. The third one is homeostasis. Living organisms maintain a stable internal environment despite changes in external conditions. For example, when our body's too hot, we sweat, and the sweating cools us off. All living organisms reproduce. We use a process called meiosis to reproduce similar offsprings, and mitosis to reproduce cells to replace the old and the damaged ones. All living organisms respond to stimuli, and all living organisms move and excrete. The anatomical position is when a person stands upright, facing forward, with their feet flat on the ground, arms at their sides, and palms facing forward. This position is a reference point for describing the location of our body parts. We have 2 more terms, supine and prone. In supine, remember sun. Supine, the body is laying on a back with face upward, and prone, the body is laying on a stomach with face downwards. Now let's explore some important directional terms using the anatomical position as our guide. So the number 1 is superior and inferior. We use superior and inferior when we're referring to the area of head, neck, and torso, which is very important to remember. For example, the head is superior to the chest, means the head is above the chest. The feet are inferior to the knees, means the feet are below the knees. So number 2 is anterior and posterior. Anterior means in front of, posterior means at the back. For example, the nose is anterior to the ears, means the nose is more at the front side than the ears. Posterior means behind. The back is posterior to the stomach. Next is medial and lateral. Medial means it's closer to the midline of the body, and lateral means it's farther away from the midline. The example of medial is that the heart is medial to the lungs, means the heart is more closer towards the midline than the lungs. The example of the lateral is that the arms are lateral to the torso, means the arms are farther away from the midline than the torso. Next one is proximal and distal. We use proximal and distal when we talk about our limbs. Limbs means our arms and our legs. So proximal means closer to the center, that is our trunk, and distal means farther away from the center. The example of proximal is that our knee is proximal to the ankle, means our knee is closer to the center, that's our trunk, than the ankle. The example of distal is that our toes are distal to the ankle, which means our toes are farther away from our trunk than the ankle. And the last one is superficial and deep. When it's on the surface, it's superficial, and when it's farther from the surface, it's deep. The example of superficial, that the skin is superficial to the muscles. The example of deep is that the lungs are deep to the rib. Now our body is divided into 2 regions. The first is axial and the other is appendicular. Under axial region, we have head, neck, and torso, and under appendicular region, we have upper limbs and lower limbs. We also have regional terms. This is more sort of like a lab topic. So if your professor wants you to know all the regional terms, your professor is a real weirdo. But I'm just going to make a whole new video on the regional terms. Now we're going to do the planes of the body. So the first plane we're going to discuss is sagittal plane. The very easy trick to remember is that the sagittal plane is going to give you sides. It is going to give you left side and the right side. If the left and the right side are equal, that plane is called mid-sagittal plane. If the left and right sides are not equal, it's called parasagittal plane. The next is frontal plane. It's also called coronal plane. As the name says, the frontal plane gives you an anterior and a posterior, means it's going to give you a front and a back. The next is transverse plane. The transverse plane cuts the body into top and bottom. So this is top and this is the bottom. The oblique plane is mainly used to examine the knee joints, where it cuts the body at an angle. Next, we're going to talk about our body cavities. Cavity is any fluid-filled space, and it protects our organs. We have two major body cavities. The first is dorsal, and the other is ventral. It's a really important topic. So the dorsal body cavity is at the back of our body, and it's divided into two subcategories. The first is cranial cavity that holds the skull and the brain, and the second is spinal cavity that holds the spinal cord. At the front, we have a ventral body cavity, and ventral body cavity is also divided into two subcategories. We have the thoracic cavity here, and we have abdominal pelvic cavity here, and it is divided by diaphragm. So the thoracic body cavity, which is on the chest area, is further divided into mediastinum, pleural cavity, and the pericardial cavity. And the abdominal pelvic cavity is divided into abdominal cavity and the pelvic cavity, as the name says. The thoracic cavity is located in the chest area and it's vital for housing and protecting the heart and the lungs. So within a thoracic cavity, the first one we have is the pleural cavity. So the pleural cavity, we have two of them. We've got a right pleural cavity and a left pleural cavity, and each one has one lung. The pleural cavity is located within a serous membrane, which is called pleura. It's a slippery double-layered membrane that reduces the friction between the organs. Next, we have mediastinum. The mediastinum is the central space in the thoracic body cavity, and the mediastinum holds heart, trachea, esophagus, and the major blood vessels. Next, we're going to talk about our pericardial cavity. This pericardial cavity is within our mediastinum. And the pericardial cavity is the one that surrounds our heart, and it's located within the serous membranes. Next, we're going to talk about the abdominal pelvic cavity. It's divided into abdominal cavity and the pelvic cavity. The abdominal cavity holds your stomach, liver, intestines, pancreas, spleen, and kidneys. Remember, the liver filters the blood, it stores fat, and it produces bile. The pancreas produces digestive enzymes, and it produces insulin. Spleen is for our immune system, and our kidneys filter blood to make urine. Our pelvic cavity holds our bladder, our reproductive organs, and our rectum. So the abdominal pelvic cavity is divided into different segments. Two systems are used to divide abdominal pelvic cavity. The first one is the four-quadrant system, which is used by most of the nurses and the doctors. And the second one is nine-region system, which is mostly used in the laboratories. Now we have a sagittal line and a transverse line divides our abdominal area into the four quadrants. So we have right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. So if the patient comes in and they have a pain in their right lower quadrant, that means it's something related to their appendix. Or if they have the pain in their right upper quadrant, this means that something is related to their gallbladder or maybe liver, which helps nurses and doctors to diagnose the problem. Now, in the nine quadrant system, we have four lines. Two lines are along the parasagittal plane and two along the transverse plane. And it divides the region into left and right superior region, which consists of right and left hypochondriac region. Hypo means below, chondriac means rib cage. So this region is below the rib cage. And in the middle of both these regions, we have epigastric region. Epi means above, gastric means stomach. And in the middle, we have right and left lumbar region. The right and left lumbar region is located in the same region as the lumbar vertebrae. And in the middle is umbilical region that's right above the umbilicus. The left and right inferior region have right and left iliac region, and in the middle we have hypogastric region. Hypo means below, gastric means stomach. Serous membranes are the slippery liquid membranes that contain serous fluid, and this fluid prevents the friction between the organs as they rub against each other. So serous membranes, they have two layers, visceral layer and the parietal layer. Visceral layer touches or covers the organ, and the parietal layer touches or covers the cavity. The three main serous membranes of the body that hold organs are the pleural membrane that surrounds lungs, the pericardial membrane that surrounds the heart, and the peritoneal membrane that surrounds the abdomen organs. Medical imaging is taking pictures of inside of our body to see what's going on, to diagnose problems, to watch how body works, and to guide the treatments. So the first one is X-ray. It's a quick photo using radiation. It's done for lungs, bones, and teeth. It's used to check for fractures or pneumonia. The second is CT scan. It's way faster. It's a bunch of X-rays that are stacked together to make a 3D image. And we use CT scan to find if there's any internal bleeding, tumors, or strokes. The third is MRI. It uses magnets and radio waves, and there's no radiation present. We use it to get the super detailed images of our soft stuff like our brain tumors, herniated discs, or ligamented tears. The fourth is ultrasound. It uses sound waves. There's also no radiation present. It's done during pregnancy or if there's any kidney or gallstone problems. Next is PET scan. It uses radioactive sugar to show active areas inside your body, and it's used to look for cancer, brain activity, and the heart function. Next is EKG, which is also called ECG. It's called electrocardiogram, and it's used to check how the heart is beating, its rhythm, speed, and electrical activity. It helps doctors to find heart attacks, to stop irregular heartbeats, which is called arrhythmias, really important word, to check if your heart is getting enough oxygen. EEG is called electroencephalogram, and EEG records the brain's electrical activity, and it shows the brain waves, how fast or slow your brain is firing. We use EEG, which is electroencephalogram, to check for epilepsy and seizures, and sometimes we use it to look at sleep problems as well. Next is homeostasis. We did cover homeostasis a little bit in the beginning. The homeostasis is the body's ability to maintain a stable internal environment even when the external conditions change. So we have four core principles of homeostasis and we have feedback loops which are very, very important. So the first is our feedback loop, that your body monitors the change and respond to that change in order to fix it. We have the negative feedback and the positive feedback, which we're going to learn in detail. Structure and function. The shape or the structure of the body part fits the job it performs. For example, the alveoli in lungs are thin and balloon shaped so that there's more surface area for gas exchange. Third is gradient drive movement. Molecules move from high to low concentration, pressure, or temperature. This is called gradient setup. It's important in breathing, circulation, kidney filtration, etc. For example, oxygen moves from lungs because of the concentration gradient that is set up. Fourth is cell-to-cell communication. Cells send signals to each other to coordinate responses. It happens through nervous system, that's electrical signals via neurons, and through endocrine system. Remember, endocrine system is linked to our hormones. Now we're going to dive deep into our loops, which is very... So our first is our negative feedback loop. So the goal of the negative feedback loop is to reverse the change to restore the balance. Too much, bring it down. Oh, it's too little, bring it up. So negative feedback loop is going to reverse the change to restore the balance. For example, during our blood sugar, if we have high blood sugar, our pancreas is going to detect that we have a high blood sugar, and our pancreas is going to release insulin. Now, insulin is going to go and take all the glucose and convert that into glycogen. This way, the high blood sugar drops to the normal range. But what if we have low blood sugar after fasting? So our pancreas is going to detect that we have a low blood sugar. Then it's going to send glucagon. Glucagon is going to go and break the glycogen back to glucose, and it's going to be in our blood again. Then our blood glucose rises to normal, and there we go. And the negative feedback loop finishes. The same is with body temperature. So our body temperature is controlled by our hypothalamus. When our body is too hot, our brain senses the temperature, the sweat glands activate, and those sweat glands start producing sweat. And that sweat cools our body down. And the same way, our temperature returns to the normal. But when we are too cold, our muscles shiver, and that shivering generates the heat. Blood vessels also vasoconstrict to keep the heat in, and the temperature return back to the normal. Next, we're going to talk about our positive feedback loop, whose goal is to intensify the change unless or until major event is completed. It's going to intensify the change so much to the point where the major event is completed. It's rare, but it's powerful and fast. For example, when A baby is born. We have a few hormones that are involved. First is oxytocin, and we have few organs that are involved. We have uterus and the pituitary gland. So what happens is that the baby's hand pushes on the cervix. The nerve signal go to the brain. The pituitary gland releases hormone called oxytocin. Oxytocin causes a really stronger uterine contractions. The more the contractions means the more baby is pushing harder because of the more oxytocin. And this loop continues until the baby is delivered. So more the baby head is going to hit the cervix, it's going to send a signal to pituitary gland to release more oxytocin, and it's going to produce really, really strong contractions. And once baby's out, means major event is completed, the loop's going to stop. The second one is the blood clotting. It involves platelets and the clotting factors. When our blood vessel is damaged, the platelets is going to stick to the injury site, and the platelets going to release the chemical, which is going to attract more platelets. Clotting factors activate, and the fibrin is formed. Once the fibrin is formed, the major event is done. The positive loop stops.